Hello and welcome. My name is Michael Winder, and I am going to present some data from an ongoing study in which we have examined the effects of two drugs on bladder function in an in vivo rat model of chronic pelvic pain syndrome. I have nothing to disclose. So in this project, we have set our sights on improving the treatment of chronic pelvic pain syndrome, or chronic prostatitis as it used to be called. Now, most urologists would probably testify that this is an exceptionally tricky disease to treat, partly due to diagnostic difficulties, but maybe mainly due to lack of effective pharmacological treatment options. Now, very many different drugs have been tested to treat this disease or syndrome, among them an array of different anti-inflammatory drugs. And among the anti-inflammatory drugs, the only recommended class of drugs today, which also has actually shown the best efficacy, are the COX-2 inhibitors. But there are many other different types of drugs that have been tested and suggested to possibly be effective in the treatment of chronic pelvic pain syndrome are drugs that affect nitric signaling. Now, there are many different types of drugs that affect nitric signaling with different mechanisms of action. So the perhaps most intriguing of the drugs that affect nitric signaling are the so-called guanylate cyclase activators, which can act independently of nitric oxide, and they can also exert their effect in an environment of oxidative stress. So the aim of this study was to investigate the effects of a guanylate cyclase activator known as BAY 602770 and the COX-2 inhibitor celecoxib, and also a combination of both on bladder function and a rat model of chronic pelvic pain syndrome. So for this purpose, an animal model for chronic pelvic pain syndrome was used. In this model, we injected either saline or zymazon directly into the dorsal lobe of the rat prostate. Now, zymazon is a drug that acts via toll-like receptor 2 and has been established as a model for chronic prostatitis. After 8 days, the rats were injected with either DMSO, serving as vehicle or control, or celecoxib, or BAY 602770, or a combination of BAY and celecoxib. This injection was done twice daily for 13 days, and on the 21st day after the intraprostatic injections, the rats were placed in a metabolic cage in which we could register the Micturition pattern and also gather urine. Immediately following the 16 hours in the metabolic cage, the rats were anesthetized and cystometry was performed. We also examined the effects of a cholinergic and a purinergic agonist during these experiments. So here are the data from the Micturition cage experiments. Please note that the data from the saline treated animals is in blue and data from the zymazon treated animals is in red. So neither induction of chronic prostatitis nor drug treatment affected the total water intake or the total urine output in any of the groups. Further, drug treatment did not affect any of the parameters in the saline treated animals. However, induction of chronic prostatitis led to an increase in micturition frequency and a corresponding decrease in the volume per micturition in the zymazon treated animals as compared to controls. Treatment with celecoxib alone improved some of these parameters, while monotherapy with BAY 602770 completely normalized the frequency in these animals. A similar effect can be seen by the combination therapy. Cystometry revealed that induction of chronic prostatitis led to a significant increase in the number of non-voiding contractions, a significant decrease in compliance, and a significant increase in voiding time. Now, monotherapy with celecoxib had moderate effects, while monotherapy with BAY 602770 normalized the number of non-voiding contractions and compliance and had a slight effect on voiding time, while combination therapy completely normalized all three parameters. When looking at cholinergic contractile responses, it is evident that induction of chronic prostatitis led to lower responses. Monotherapy with celecoxib did not affect this. Monotherapy with BAY 602770 significantly improved the cholinergic responses, while combination therapy completely normalized them. A very similar pattern can be seen for the perinergic contractile responses. So to conclude, induction of chronic pelvic pain syndrome with zimazon led to distinct signs of bladder overactivity, indicating sensitization of afferent signaling. Further, induction of chronic pelvic pain syndrome led to decreased agonist-induced bladder contractile responses and prolonged voiding times. Treatment with the soluble guanylate cyclase activator BAY 602770 alone or in combination with celecoxib normalized Micturition frequency and restored bladder function. Now, in the future, clinical studies are required to investigate the efficacy and safety of BAY 602770, both alone and in combination with celecoxib, for the treatment of male patients with chronic pelvic pain syndrome. Thank you for listening.